Morning, everybody. My name is Suzanne. I'm with the CFILC Ability Tools, and today's webinar is on assistive technology product demonstration with Boogaloo Beds, and this is presented by the CEO, Caleb Polley. So, with that, I'd like to pass this on to Caleb.
Great, thank you so much. And yeah, my name is Caleb. I'm the CEO and founder of Boogaloo Beds. Looking forward to talking with you all today. And I'm gonna switch my screen really quick. Perfect. Yeah, I met Ann Bowie, who's the program director at CFILC at the Assistive Technology Industry Association conference in Florida about a month and a half ago. And we had some really good conversations. Some great feedback throughout that conference from doctors, from OTs, from a lot of families, and some of the kids themselves on our product. And Anne had recommended that I come in and talk to you guys a little bit more about the product and how it might fit into the California assistive technology and disabilities community there. And so yeah, looking forward to talking with you guys today. As mentioned, I'd love to get questions throughout. So at any point, if there's confusion or you need a little bit of clarity or you have some suggestions or thoughts, feel free to hit that raise hand button and I'd love to talk with you further. And so to kick things off, I thought I'd show you a clip from one of my favorite TV shows. It's a pretty popular hit series called Atypical, which some of you may have seen. It's about a young boy named Sam who has autism and about his life as he kind of navigates through high school, through his social settings, and just life in general. And to kick things off, show you this quick video about some of the issues that Sam's gone through that I think our product can really address.
Welcome to the Dragon's Lair, homie. I did my best to sandproof the digs. For example, I put a cover on that mattress so it doesn't make sound in the night. And I borrowed that fancy smell maker from my roommate. Your mom? My roommate.
I'm talking to you.
Emergency.
What have you been taking? You tweaking?
Sam.
Whoa. Hey.
No, it's okay. He has
I don't know
autism.
who you are, but you need to step back.
You don't get it.
I said get on the ground. Get on the ground.
It's a scary world out there.
So that was a clip from Atypical and a situation that's all too common in the autism community. When I talk to a lot of the families that I've talked to, some of them have went through similar situations, and some it's paranoia around this happening where their kid has a sensory meltdown or seeks out sensory stimuli, resulting in eloping or wandering from a safe environment, such as their house, and some even results in police activity or sometimes police arrests or injury or even worse. And so that's something that we're really focused on helping these families overcome and really creating an environment that would help kids like Sam not have to deal with those types of situations. And so a few months ago, I met a young boy named Josh, and similar to Sam, he experiences a lot of sensory overload and elopement issues as well. At 7 years old, Josh has a big life ahead of him. He's fun, loved by his family, and he also has autism, similar to Sam. With Josh, this results in a lot of issues with calming down, with safety concerns, and he often only gets a few hours of sleep at night. Up to 80% of kids with autism have daily sleep issues like Josh. I'm not sure about you guys, but when I don't sleep as well, my learning's affected, my energy, my temperament, even physical growth. 50% of these kids also have severe safety concerns, so that the 50% stat specifically comes from eloping from safe environments, whether that's completely from the house or from their bedroom into the kitchen at night where they're getting into things that they shouldn't be, or from safe environments when they're out in public with the family. As well, they can often result in seizures or self-harm activity, such as headbanging or other issues that are quite common in the autism environment and something that we're trying to help with. And these issues, they don't only affect Josh, they end up affecting his entire family, resulting in job loss, divorce, or sometimes having to move houses entirely. It also hurts the siblings sleep environments and their relaxation, which often results in them not sleeping as well and them not going to school, even if they're neurotypical. One of the root causes of these issues is sensory sensitivity. Many people with autism are unable to or have issues processing their sensory environments. As a simple example, Josh often cups his ears to block out sound and rocks back and forth to help with his vestibular motion or sense of balance. Sleep is constantly disrupted by stimuli from siblings, neighbors, or household activity. As well, many of these kids tend to have kind of racing minds or anxiety around times of sleep when they can't self-stimulate by rocking or by having sound. As well, these sensitivities can often result in a fight or flight response. Or in other words, when they have a sensory meltdown or sensory overload, they run out of the house or flee a safe environment, or have meltdowns where they may hurt themselves or sometimes harm others, such as their siblings or their parents or caregivers. Now, it's not all bad. Many people with autism have told me that they experience the world in a much more intense, vibrant way, and that good sensory feelings are perhaps more enjoyable than I would ever experience as a neurotypical. And this can result in great creative achievements in music, in art, and also a lot of issues as well if it's not properly regulated and environments are controlled to what's helpful for them. So right now, there's really two types of ways that families are currently trying to solve these situations. The first are pharmaceutical drugs, which are often prescribed as toddlers. Many parents hate giving these as they can have terrible side effects, especially when compounded with other daytime medication. And in fact, the world's largest autism sleep study, put out by two of our advisors at the University of Colorado, Denver and CU Anschutz, showed that although these drugs do put the kids to sleep, basically by knocking them out, they often result in worse daytime behavior the next day from those side effects and from not as good quality of sleep. Parents and caregivers do see a need to help with these problems though, so many have currently started making their own crude versions of our products. I've seen anything from converted bunk beds to the lattice style kind of cage-like device up top to just putting tents and bed tents over their beds, which are often destroyed pretty quickly. The professional products have been kind of inspired by those often from parents themselves, but they only focus on safety via confinement and ignore much broader sensory and sleep needs. What's validating for us though as a product is that many of these products have millions of dollars in sales, showing that there is demand for them even if it's not solving all of the problems. And they've already set up the FDA and insurance reimbursement pathways for our product with these more advanced features to go under, really increasing our time to market and making it much more accessible for families that can't always afford to pay for it themselves. So to help with these issues, we're creating smart beds that allow a person to completely control their sensory environment. I'll get into the individual features in a little bit more detail on the next slide, but at a high level, the canopy helps block out sensory stimuli, creating a cozy, safe space. We then use calming stimuli to help people relax during the day, during times of stress or meltdowns, and sleep better at night. And to help with safety, we have padding, cameras, and sensors that can provide increased varying levels of independence as a person matures and becomes more independent on their own. So diving into those features in a little bit more detail, the sensory canopy over the top, it provides 360 degrees of padding to prevent injury. That padding it's basically tensioned fabric across the steel frame. And so if you're pressing outwards from the inside, there's not a single hard point that you could hurt yourself on. It also helps prevent visual stimuli, light stimuli, and helps a bit with sound. Many kids with autism are drawn to smaller spaces, especially during times of stress. And some of my favorite stories are finding kids like under a couch or in between two mattresses or under the stairs in the like basically in the Harry Potter style closet you can think of, where they're seeking out those small sensory spaces because it helps control the environment and is really calming. As well, that sensory canopy can be fully enclosed, so that can prevent elopement and help with self-harm and safety issues during the night. But with that, we don't want to be only an enclosure-based product. There's a big movement towards less focus on seclusion and on restrictive elements, and so we want to be able to provide varying levels of independence as a child or an adult matures and can basically be allowed to have that independence because the safety has been earned, and they have the trust with their caregivers to do that. And so to provide that, we have two different elements. One is that we'll have safety sensors. So when someone leaves the bed, we'll have latch-based sensors that as soon as they leave the bed, the contact within the sensor breaks, and it'll give a notification to the parent that someone's out of the bed. We also will have movable motion sensors, so parents can put a motion sensor right outside the bed or in the hallway outside of the bedroom, so that if they do leave the actual bedroom, they can also be notified in that manner. Both of those will be linked to a camera, so as soon as one of those sensors fires a notification to the caregiver's smartphone, they can check there on the camera and make sure that, oh, Josh is safe in his bed, or, oh no, I should actually run up there because he's getting into something he shouldn't be, or he's clearly stressed out and needs some help from me. As well, on the sensor side, there's a lot of elements within a bedroom environment that are very critical to control, but often overlooked. One of the most common is temperature. We typically sleep at much higher temperatures than we should, typically hovering around 80 degrees, and really household environments for sleeping should be kept at the high 60s to low 70s. And so our sensors can provide that information in the app so that you can control that and have constant monitoring over those temperature issues. Same thing with humidity. This varies location by location, and so you can use humidifiers or dehumidifiers to help with that. But many people aren't monitoring this, which can lead to higher increasement in sleep apnea, in congestion, in dry eyes in the morning, and just sleep quality in general. So we'll have a humidity measurement tool as well. And then finally, we'll have a sensor that can control and measure sound. So if there is yelling in the night, or if there's a loud bang, that will trigger a notification as well, and the parent can check on the app. Next feature are the safety sheets. And so these sheets zip into the sidewall of the bed. This helps prevent entrapment, which is a pretty common issue with hospital beds. A hospital bed quasi-competitor in the early 2000s called Vail Hospital Beds was actually shut down by the FDA, making enclosed bed products because kids were getting entrapped and were getting hurt. And so these safety sheets zip into the sidewall over top of the mattress, so it's virtually impossible for someone to get entrapped within the bed. It also makes cleanup much easier. If someone has incontinence issues, instead of digging into a gross fitted sheet in the corners and reaching across the bed in that way, I'm sure many families hate doing that, you can just quickly zip out the sheet and zip in a new one, wash the other one, and you're good to go. On the sensory side, we'll have a couple different sensory elements. So right now we have circadian rhythm lights built in, designed by Philips, and these have varying colors and brightness. So as you go to bed, it can slowly fade out the light, similar to a sunset. So starting with bright white lights and slowly fading into red wavelengths, which have actually been clinically proven to improve onset of sleep. On the opposite end, instead of waking up with a jarring alarm in the morning, you can fade in the light, similar to a sunrise. And this can actually help improve circadian rhythm in the morning with increased energy and alertness in the morning by having that bright levels of light. Especially for someone who's often in bed 15 like minimum probably 7 to 8 hours. Some of these kids are in bed 15, 20 hours a day. They don't get a lot of natural light. So providing that bright light therapy during the day can actually be really helpful as well. We'll have surround sound speakers that can play white noise, nature sounds, audiobooks, or music. And this can be an active noise cancellation system to prevent sounds like TVs in other rooms or siblings playing, which can be very distracting to sleep. It can help block that and provide a lot of calming sensory input in that way. We'll have mattress vibration underneath to provide tactile input. And then we'll partner with weighted blankets and aromatherapy companies to provide the pressure, deep pressure input, as well as olfactory sensory input as well. And I'm just going to go back to this slide just to give a little bit more visual on kind of how that all looks like. And then in a second, I'll get into actually where we're at with our real product. These are 3D renderings. So on the smart sensor and smart feature side, all of this is connected to two different apps. And so those sleep sensors can provide notifications, which you can then check on the cameras. We'll also have video storage, which is very useful for basically you can trigger off video recording, either continuous or if movement is activated. And so this is a great thing to provide doctors or OTs if there's a seizure during the night. That will trigger that movement and it will start recording, and you can provide recording of that. or perhaps certain, they're up 5 times a night, and it's kind of hard to prove that or hard to show that to a doctor. Well, now you can actually come into the doctor's office with automated video recordings in 1080p quality and be able to provide that to the doctor. Finally, the sleep guidance app, by using those sensors and by helping to monitor the environment, we can provide suggestions around what would help improve sleep. The long-term vision is to be able to correlate things like changes in environment, changes in medication, or changes in diet to how well someone is sleeping, how much they're moving during the night, perhaps even how many seizures they're having. And over time, with enough users in the app, we'd be able to see trends in that data and perhaps unlock some really useful research. So a lot of people will ask me as well, what's kind of my story or my inspiration of getting here? And it comes down to kind of 2 different paths. So one is that on the left there is my good friend named Ben, who has Down syndrome. And I was actually paired up with him in 5th grade class. For whatever reason, the teachers really saw that I was drawn to him and we were becoming good friends. And so I actually ended up being paired with him in almost every class throughout middle school and some of high school until the education paths kind of part ways. But we had a really good relationship, and I really enjoyed that friendship and growing together as kids. My brother as well has a good friend named Colin who had cerebral palsy. He was often over at our house, and yeah, we just had a good relationship there as well. And then the product actually started on a little bit different route. So we were originally building pod beds for any type of shared accommodation. So specifically, it came from my own troubles of staying in travel hostels and being woken up in the night, having very little privacy, having things stolen. And then I learned that that could be applied to a lot of different things. So university dorms, we were selling them to university dorms for their shared dorms, homeless shelters, disaster relief sites, really anywhere where people are sleeping in the same room as another person. It provided some extra privacy. But while I was building those beds, I kept having parents and doctors come up to me at events while I was showing off the product and saying how much it would benefit people with a wide range of sensory disabilities, but really focused on kids with autism. And from there, I looked at those existing products, thought there had to be a much better way to do it. I know a lot about technology and come from a strong technology background, and so really dove into how we could use sensors and technology and camera to provide a much more modern day device that could really be a long-term solution for people, and hopefully something that they would choose to try even before some of these more hard medications that they're put on at such an early age, or in combination with, depending on what the doctor's recommendation is. So progress-wise, we've made a lot of progress over about the last year and a half of developing this version of the product. This is our current prototype that's in progress right now. Basically, it comes with all of the features that were described. We've built 3 prototypes, so different iterations. I've actually built 4 versions of this so far and 3 previous iterations on kind of a different look of the product. With that, we've interviewed now over 300 parents and families through surveys, focus groups, and at events. Also met with a lot of schools, a lot of clinicians, really anyone that's a thought leader in this space. We've secured investment from some of the top angel investors specifically in the special needs community. So our lead investor is a micro venture capital fund called ARC Capital that specifically focuses on special needs related investments. And their chairman is also our acting COO, sits on the National Autism Society board, was the previous president of the Autism Society of Colorado. And we have a couple others in the space that are from hardware and medical backgrounds, as well as one that's from a very deep clinical background helping with therapies. We've also won a lot of local pitch competitions, which gives a lot of validation to our story and the problems that we've solved. And then we have manufacturing and our regulatory strategy all lined up. So we're working with local manufacturers here in Colorado, all made in America. Our regulatory strategy is pretty concrete as well. So working with the FDA to figure out how do we make this product as safe as possible, reducing risk, and providing a lot of assurance and certifications around that. With that manufacturing and regulatory strategy, we're on track to launch here locally in Colorado early this summer, and then hope to start spreading to other states after that, specifically focusing on California and New York as they have large population sizes, as well as pretty good health coverage for products like this. Really 4 specific goals that we're focusing on here. Safety leading to higher levels of independence. So that's really using those cameras and sensors to provide increased level of independence over time. Better sleep for the entire family is very important. So not just for the user, we really want to focus on the parents and the siblings as well. When a parent doesn't sleep, they don't parent as well. And then that results in the kid not improving as well. And it's just this really vicious cycle that I think we can provide a lot of benefit to every party involved. Promoting self-regulation is another big aspect. So having a safe space that when someone's feeling stressed out or when someone's about to have a sensory meltdown, they can use our product to help with those sensory inputs and help create a controlled environment that they're used to and that is kind of their safe space that they can go to when they need. And then finally, a long-term goal for me is really employing the community. So whether that's on the manufacturing side with actual people with special needs helping out there, or on customer support, I think one of the biggest opportunities here is using the kind of classic autism mom who had to quit her job to stay at home and stay with the kids helping out. But she would be the most empathetic, most passionate person to help with customer support and with sales support from a remote location. So she can still be at home with her kids, but she's working with the community that she's so passionate about. We've gotten some really great feedback on the product. Everything from, the top left one was the most moving for me. I got this email a couple months ago at about 1 a.m. from a mom who was actually in the hospital at this point, and she just, her son was having a sensory meltdown. He flew out of the house, and she chased him out of the house and fell down the stairs and broke her shoulder. And so really needs a product like this. I think there's a lot of flip side on the positive side as well, where there's a lot of opportunity to improve things like learning and self-regulation and energy levels, and just really a full life improvement comes from sleep. Sleep is so critical, and peace of mind on the safety side is also just as critical. So 2 different routes that we're going with purchasing options. The first is that this can be insurance covered, typically through Medicaid, but sometimes private insurance will cover it as well. Typically, that's only for severe safety concerns and often does come with a rejection or two because it is an expensive product. But from an insurance company perspective, a $9,000 product is much cheaper than a visit to the emergency room due to falling in water and having a lot of issues there, or injury, or seizures that are hurting and falling out of bed. So we're hoping over time that we can increase the levels of insurance coverage. But right now there is insurance coverage across many states. It does vary state by state for those existing competing products. On the cash payment side, this can go 2 ways. One is that we'll definitely set up payment plans for families that are able to afford this personally. And then Medicaid waivers are going to be able to provide some flexible funding options for many families if Medicaid itself doesn't cover a product like this. Quite a few tangential markets as well. So we're really focused on kids with special needs and specifically kids with autism at this time due to the high rate of incidence with 1 in 59 kids having autism. But we've had a lot of interest on the dementia side as well. Very, very high population as the baby boomers age. My kind of hypothesis there is that as the baby boomers age into retirement and dementia becomes more and more common, we're going to have to see more and more shared accommodation just due to a financial, economical perspective. And so with our products, we can create a room within a room that allows them to have their own environment, their own independence, their own privacy, while from an economical standpoint still working well. Also lots of fall risk, and medications frankly have talking to a lot of the clinicians on this side, sleep medications often have an opposite effect on dementia. And so there isn't a great solution out there right now, but sensory issues are very common and are becoming more and more common in American assisted living facilities, actually creating sensory and snoozling rooms, very common in Europe, becoming more common here. And I think we play into that well. Quite a few other special needs that can also be covered. So cerebral palsy, Down syndrome, epilepsy, Fragile X, sensory processing disorder, as well as traumatic brain injuries, all have similar needs to what this product can cover. Shared housing, kind of where I initially started. I think we'll eventually get back into that if we can really bring the price down of the product with more volume and economies of scale. PTSD is something else that I hear pretty often. And then every time I present this, no matter really who the audience is, there's always some people that come up to me afterwards that don't have any standard medical conditions, but they just want a better controlled environment, especially if you're living, say, like street level in New York City. It can be really hard to actually control that environment, so our bed can help there. Using these different channels, our goal is over the next year or so to sell about 200 of these beds, really focused on two things. One is medical distributors, so typically NuMotion, National Seating, kind of DME, HME distributors are able to help us process through insurance. And then focusing on really building community through online advertising, through search engine optimization, through events marketing. This is a very, very connected community driven with word of mouth. And I think if we can prove that this product works and we have great stories, it'll be really spread like rapid fire through these family communities. Product roadmap, we're really starting with building it out pretty simply with off-the-shelf components, and then over time, we'll keep upping the amount of self-engineered components that allow us to move into the deeper sensor integration of providing automation around the product. Things like if a kid wakes up and is up for more than 5 minutes, trigger the sensory calm down routine to start again, or trigger if they get out of the bed, that allows it to turn on lights throughout the house so that they don't have issues navigating throughout the house. As well, we'd eventually like to integrate this data actually into doctor and teacher infrastructure. So for doctors, it can provide useful input of you just prescribed this medication and the kid is now sleeping 3 hours less per night. For teachers, it could be Josh got 3 hours less sleep last night, so you might expect him to be a little bit more cranky or not learning as well today, and we could fire off an email or something like that to them each morning, giving them an update on how their sleep was, because it's so critical in their impact for the rest of the day. And then finally, really, as it comes with developing hardware, the costs are really high in the beginning, but as we move to more and more volume, we really hope to bring this down to under $1,000 price point that's much more accessible to every family, especially families outside of the US, like South America, Southeast Asia, places where population density is incredibly high. Sensory elements are even worse there, but there's still many, many kids with these issues that we could help if we were able to develop a lower price point. Here's the team. So I'm Caleb. I've done 2 previous businesses before, really focused on the e-commerce and events marketing side of things. Spent tens of thousands of dollars in online advertising, so really know how to reach people online. And then I've also have a lot of experience working at high growth software companies. And so doing sales and business development on that side of things. Donna's a local wonderful lady in Colorado Springs who's been helping with sewing and supply chain, and she'll be our contract manufacturer to scale up the soft good components. I'm doing most of the engineering myself on the frame and electronic accessories. And then Kevin is the chairman of Art Capital and also our acting COO. He's done quite a few businesses in this space. His most recent business was an autism therapy business that was acquired a couple of years ago, and is also heavily involved in the Autism Society. Oh, I've got some fancy animation on this one. Missed that. Kathy is a director at CU's Assistive Technology Partners, which I think is kind of a similar organization to CFILC in some ways. And so providing a lot of assistance around actually doing analysis and studies, as well as prescription around these products, as well as sleep positioning and wheelchair positioning. Kelly is the sleep positioning specialist there, so has been really great in terms of helping me improve the product along those sides. And then Jeff Jensen comes from Medtronic, so deep clinical background, as well as Judy, who also comes from Medtronic. Jeff's more on engineering side, Judy's more on actually doing clinical trials. So that wraps up a lot of the presentation. I would love to hear your thoughts, your potential concerns, any feedback that we have on the overall product, and then we can move on to some other questions as well.
Oh, hi everyone, this is Suzanne. Elizabeth just said, when did you, sorry if I missed this, when did you say this product will be available in California for purchase?
Yeah, so we're aiming, I think that's a little bit up in the air just based on the development cycle. The goal for me is to launch here locally in Colorado. I'm based in Denver, and from there we'll start selling the product here locally so that I can actually be in the homes, working with the families, really trying to actively improve the product. There's a ton of little things like, for example, even the tension of a zipper. Someone perhaps with low muscle tone might not be able to pull that. So understanding that we need to develop a new type of pulling or a longer strap, that would be really beneficial. on a rough timeline, I would guess that we'll probably be looking at California late fall, early winter of this year.
Great. Thank you. Okay, perhaps we should move on.
Sure. So this is one of the things that is a little bit up in the air as well, is each state has different levels of coverage for products like this. So I'd love to learn more if any of you guys have worked with any of those other enclosed bed products, or just understanding, how do I learn more about coverage there? How do I make sure that this can be accessible for as many families as possible, hopefully from an insurance or Medicaid coverage perspective? So if you guys have any thoughts or any tips or feedback on that, that'd be really appreciated to talk through.
Anne just said, may want to connect with Kaiser Foundation.
Okay. Yeah, that's a good tip. I will definitely look into that. Makes sense. Go to the next slide.
Yeah.
Okay. So this last thing, this is a lot of the feedback I got from some of the conferences I've been to, is that everyone really understands the product. It seems like they've used a lot of these sensory elements already. They get it. But from a medical perspective, from an actual prescription perspective, we're kind of trying to work through, what do we actually need in order to validate this? Is it an actual clinical trial, which is very costly and takes years? Is it small level case studies? Is it compiling a lot of research from each of these sensory elements and kind of explaining how that's brought together? Any thoughts on how best to validate the technology, as well as then reaching medical doctors and OTs from a distribution perspective? How do I make sure they know about this? Well, it can also be, I'm very open to additional conversation around this. So if any of you do feel like it'd be worth having a longer discussion, I'd be very happy to set up another time to talk and just have a more in-depth chat there. And on the last slide, you have my contact information as well, so you can feel free to reach out to me.
Great. And Anne just suggested that there are OT and PT medical schools. She also suggested the UC Davis Mind, M-I-N-D, Mind Institute, and also at UCLA.
Great. Yeah, thanks so much, Anne. I'll definitely look into those. And as well, on that front, if anyone has decent relationships with anyone at any of these institutions or any other applicable institutions, introductions are always very much appreciated. Makes it a lot easier. Perfect.
And that Anne said that she's happy to send you the links via email.
Great. Thank you, Anne. I appreciate that. All right. Well, moving on. In conclusion, really our big mission here is that everybody has the right to build a happy life, a life where they get a good, safe sleep every night. And with Boogaloo Beds and all the innovation that we're bringing into this, we're confident that this really will be a big boost, not only for the users of the product, but the entire community, their family, their siblings, the caregivers, really everybody involved. And so any support that you can give in this journey is really appreciated. And yeah, thank you so much for taking the time to listen to what we're doing today and give some feedback. If anyone else has any other feedback, this is my final contact information, and I'd love to talk with you further.
Great. I just want to also comment that this is a really cute slide of a young boy pointing his fingers at two different text windows. One saying, with the contact information of, it's Caleb, C-A-L-E-B, at Boogaloo Beds, BOOGALOOBEDS.com. And the other bubble says, thank you, exclamation mark, and asks for further questions. So, Anne has said, thank you, Caleb.
Thank you, Anne. I appreciate so much you bringing me in here and giving me the opportunity to present to you guys. Thank you so much for moderating and helping me through this process as well. I really appreciate it.
My pleasure. All right.
Wonderful. Have a good rest of your Friday and weekend, everybody.
Thank you. Goodbye.
Bye.